Depression is a complex and severe condition of mental and emotional distress that manifests as a prolonged period of experiencing negative emotions, such as sadness, anxiety, and loss of interest in activities that once brought joy and happiness. It is a condition that can affect anyone, regardless of their background, circumstances, or experiences. Depression is a condition that can creep up on an individual, slowly and insidiously, making it difficult to recognize the symptoms until they have become overwhelming. As the condition progresses, individuals may experience a multitude of symptoms that impair their ability to function. Persistent negative emotions, loss of interest in activities, sleep disturbances, changes in appetite, and difficulties with concentration and decision-making are just a few examples of the many symptoms that can occur. These symptoms can be debilitating, making it difficult for individuals to perform even the simplest tasks. Everyday activities, such as getting out of bed, taking a shower, or cooking a meal, can become overwhelming challenges. Depression is not merely a mental and emotional condition, but a condition that affects an individual's entire being. It can impact their relationships with others, their work, and their physical health, causing significant distress, impairment, and suffering. Individuals with depression may withdraw from social interactions, becoming isolated and alone. They may struggle to maintain relationships as the emotional pain and distress become too much to bear. The condition can also have a profound impact on an individual's quality of life. Simple tasks can become overwhelming, and everyday activities can feel like insurmountable challenges. The feeling of hopelessness and despair can be crushing, making it difficult for individuals to see a way out of their suffering. Depression can also affect an individual's physical health, leading to changes in appetite, sleep disturbances, and fatigue. The emotional pain and distress can also manifest physically, leading to headaches, stomach problems, and other physical symptoms. Depression can also affect an individual's self-esteem and confidence. The negative self-talk and self-criticism can be relentless, making it difficult for individuals to see themselves in a positive light. The feelings of worthlessness and guilt can be overwhelming, leading to a loss of identity and purpose. Individuals with depression may struggle to find meaning and purpose in their lives, as the emotional pain and distress become too much to bear. Despite its severity, depression is a treatable condition. With the right support, therapy, and treatment, individuals can learn to manage their symptoms and regain control over their lives. However, it is essential to approach the condition with compassion, understanding, and patience, recognizing that recovery is a journey that takes time, effort, and support. It is also important to recognize that depression is not a sign of weakness, but rather a sign of strength, as individuals are able to acknowledge their struggles and seek help. Depression can have a profound impact on a person's life, affecting various aspects of their well-being, relationships, and daily functioning. It can bring about persistent feelings of sadness, hopelessness, and emptiness, making it difficult for individuals to find joy and pleasure in activities they once loved. As the condition progresses, relationships with family and friends can become strained due to withdrawal, irritability, or lack of interest. Individuals may struggle to maintain intimate relationships or feel disconnected from loved ones, leading to social isolation and loneliness. Daily functioning can also be severely impacted, as individuals may experience difficulty concentrating, making decisions, or completing tasks. Fatigue, lethargy, or lack of energy can make it challenging to maintain a regular routine or adhere to responsibilities. Changes in appetite, sleep patterns, or physical activity can further exacerbate the condition. The physical health of an individual can also be affected, with changes in appetite or weight, sleep disturbances, fatigue, headaches, or other physical symptoms becoming common. Moreover, Depression can increase the risk of chronic diseases, such as diabetes, heart disease, or stroke. Career and education can also suffer, as individuals may struggle to maintain employment or academic performance. Absenteeism, tardiness, or decreased productivity can become a norm, making it challenging to meet deadlines, complete tasks, or make decisions. The feeling of being overwhelmed or uncertain about future plans or goals can be debilitating. Leisure activities that once brought enjoyment and relaxation can become a source of frustration and disappointment. Individuals may struggle to find pleasure or relaxation in activities they once loved, leading to feelings of disconnection from others and the lack of social connections. The treatment of depression is a multifaceted approach that involves a combination of therapies, lifestyle changes, and medication. When an individual is diagnosed with depression, the first step in treatment is often to establish a strong therapeutic relationship with a mental health professional. This relationship provides a safe and supportive environment for the individual to explore their feelings, thoughts, and behaviors. One of the most effective treatments for depression is psychotherapy, also known as talk therapy. This type of therapy involves working with a trained therapist to identify and change negative thought patterns and behaviors that contribute to the depression. There are several types of psychotherapy that can be effective in treating depression, including cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that focuses on identifying and changing negative thought patterns and behaviors. This type of therapy is based on the idea that an individual's thoughts, feelings, and behaviors are interconnected, and that by changing one of these components, the others can also be changed. CBT is a problem-focused approach that involves working with the therapist to identify and challenge negative thoughts and behaviors, and to develop more adaptive coping strategies. Interpersonal therapy, or IPT, is another type of psychotherapy that can be effective in treating depression. This type of therapy focuses on improving communication skills and relationships with others. IPT is based on the idea that depression can be triggered by problems in relationships, and that by improving these relationships, the depression can be alleviated. This type of therapy involves working with the therapist to identify and challenge negative patterns of communication and behavior, and to develop more effective ways of interacting with others. Psychodynamic therapy is a type of psychotherapy that focuses on exploring the underlying causes of the depression. This type of therapy is based on the idea that depression can be caused by unconscious conflicts and unresolved issues from the past. Psychodynamic therapy involves working with the therapist to explore these underlying causes and to develop a greater understanding of oneself and one's behaviors. In addition to psychotherapy, medication can also be an effective treatment for depression. Antidepressant medications work by increasing the levels of certain neurotransmitters, such as serotonin and dopamine, which are involved in mood regulation. There are several types of antidepressant medications, including selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and tricyclic antidepressants or TCAs. Selective serotonin reuptake inhibitors, or SSR, are a type of antidepressant medication that works by increasing the levels of serotonin in the brain. SSRIs are commonly used to treat depression, anxiety disorders, and some other conditions. Examples of this include fluoxetine, sertraline, and paroxetine or Paxil. Serotonin norepinephrine reuptake inhibitors are another type of antidepressant medication that works by increasing the levels of both serotonin and norepinephrine in the brain. Serotonin norepinephrine reuptake inhibitors are commonly used to treat depression, anxiety disorders, and some other conditions. Examples of serotonin-norepinephrine reuptake inhibitors include venlafaxine or Refexa and duloxetine or Cymbalta. Tricyclic antidepressants are a type of antidepressant medication that works by increasing the levels of both serotonin and norepinephrine in the brain. Tricyclic antidepressants are commonly used to treat depression, anxiety disorders, and some other conditions. Examples of tricyclic antidepressants include amitriptyline and imipramine. In addition to psychotherapy and medication, lifestyle changes can also be an effective treatment for depression. Regular exercise, healthy eating, and adequate sleep can help to improve mood and reduce symptoms of depression. Engaging in activities that bring pleasure and relaxation, such as hobbies or spending time with loved ones, can also help to improve mood and reduce stress. Another important aspect of treating depression is social support. Having a strong support system of family and friends can provide emotional support, practical help, and a sense of connection and belonging. Support groups, either in person or online, can also provide a sense of community and connection with others who are going through similar experiences. Finally, it's essential to note that treating depression is a process that takes time, effort, and patience. It's not something that can be cured overnight, but rather something that requires ongoing attention and care. With the right combination of therapies, lifestyle changes, and social support, individuals with depression can learn to manage their symptoms, improve their mood, and regain control over their lives.